The question no one wants to ask about organ donation. Hello, I am Dr. K. Paul Stoller. Organ transplantation is one of medicine's greatest achievements. It saves lives every day. But it depends on something far more fragile than technology. It depends on trust. Because before an organ can be donated, a decision has to be made, a final one, that a person is no longer alive. So here's the question no one is comfortable asking. Who makes that decision, and how independent are they? In modern medicine, there are safeguards. Doctors who declare brain death are not part of the transplant team. Protocols are strict. Criteria are standardized. In theory, the system is designed to protect the patient first. But here's where discomfort begins. Even if individuals act with integrity, they still operate within the same institutions, the same hospitals, the same systems that benefit from successful transplants. And when life, death, and value intersect, even the perception of influence matters. Because trust isn't just built on what's true, it's built on what people believe is beyond question. If families start to wonder, even for a moment, whether every decision was made solely for the patient, that trust fractures. So what would true independence look like? What if the team determining brain death had zero connection, no institutional ties, no financial alignment with any system that benefits from organ procurement? Not just separation on paper, but complete structural independence. Of course, medicine is complex. Decisions must be timely. Systems must function. Lives are waiting. But the question remains, should efficiency ever come at the cost of absolute trust? Organ donation is one of the most profound acts of human generosity. But that generosity depends on something sacred, the certainty that the decision of death was made without influence. Because in the end, it's not just about saving lives, it's about making sure we never lose trust in how life ends. Be that as it may, there's another layer to this conversation, one that makes the question of independence even more important. In some countries, like Canada, medical assistance in dying, MAID, is legal and regulated. And in certain cases, patients who choose MAID may also choose to become organ donors. There are safeguards in place, separate consent processes, independent assessments, clear protocols. But when these systems exist side by side, it raises a deeper ethical question. Should a system that determines the end of life ever be connected, even indirectly, to a system that depends on that outcome? Not in practice, not in perception. Because once those lines begin to blur, even slightly, trust doesn't just weaken, it breaks. End-of-life care and organ donation must remain ethically separate, not just by policy, but by principle.